Welcome to Leaders and Legends, the podcast focused on leadership and clinical trial execution. I'm your host, Patty Lushton, CEO of Diligent Pharma. In each episode, we'll get to know the individuals who are driving change and influencing the direction of our industry. Whether you're a seasoned executive yourself, an emerging leader, or simply passionate about clinical trials like I am, join us as we discuss our industry's most pressing challenges, the future of clinical trials, and hear insights and advice from the leaders who are moving our industry forward. Michelle, welcome to Leaders and Legends. So I usually start these conversations with leaders by starting with the origin story. And I'm wondering if you could talk a little bit about what it was like growing up as a kid in New Mexico, and is there a thread that connects your childhood with your leadership journey? Let's start there.
Great. Well, thank you so much for having me, Patty. And, it's really exciting to have the opportunity to speak with you. Yeah, it's an interesting question. I mean, I guess, all of us are kind of like sculptures and we're shaped by so many different journeys in our life and chapters of our life. But certainly, growing up in Los Alamos, New Mexico, as the daughter of two scientists and the granddaughter of a fairly famous nuclear physicist, I think that the experiences I had growing up were definitely pivotal to me becoming an inventor or an entrepreneur, and somebody who just was in an environment where building new things was very much valued. It was part of the culture and part of I think what the community I grew up in really valued and appreciated is how to spend your time and how to spend your brain energy.
Right. And I know that you also were an athlete, so playing Division I soccer. And did that also sort of inform your leadership journey, just being part of a team and being the captain of a team?
Absolutely. I think that I would say kind of core to who I am, I'm really an inventor at heart. But the other, um, I guess, kind of big part of how I enjoy living my life is in teams, working in teams, achieving big things in teams. And when I was young, I was actually a gymnast and I did a lot of individual sports. And then I, started to play soccer when I was about 15 years old. So I was late to the sport, but I just loved this challenge where people were working together to achieve a common goal. And in many cases, we were the underdogs. And I think that that's actually a pretty powerful position to be in because then you can surprise the world with what you accomplish. And so I went on to play D1 soccer in undergrad at the University of New Mexico. And again, we were the underdogs and we just were able to prove to the world year over year that we could get better, that we had, great team chemistry, and that, by pushing yourself every day as a team and pushing one another, we were able to achieve goals that I don't think anyone really thought was achievable when we started out.
Yeah, well, it's interesting because when I talked to your colleague Pam, we talked about her being on a volleyball team and how it taught her really about how important diversity on teams is. And I also played basketball, not at the level that that you played soccer, but even understanding the importance of fundamentals and just good communication and working together as a team, I think is so important. And when you talk about underdog, do you feel like you were sort of an underdog getting Medable started in terms of like where the industry was at the time? I think it was 2015. Is that right?
Yeah, we had been working on some of the underpinnings of Medable like back in 2013, just
Yeah.
conceptually.
Hmm.
And really started with this idea that there should be a platform that creates a bridge to patients and for healthcare and research. I shouldn't say I think of myself as an underdog in a negative way. I don't really think about my position on in the context of the competition.
Yeah.
Um, but when you take a look at the realities, women are outsiders in the world of entrepreneurship and venture capital. And certainly being a female physician, you're not coming in with a Harvard MBA or a Stanford MBA. So I think that in that sense, just not being a part of the ecosystem, a part of the network, you're inevitably an outsider and therefore a bit of an underdog. Um, which again, I personally love because I think a big part of the entrepreneur mentality is you're going to bet on yourself, not because you think you're so great, but you'll do almost anything it takes to figure something out. And you're
Yeah.
betting on your own self, like your resilience and your fortitude and determination. So I always thought, looking around, if other people can do this, and I didn't know how hard it was, nor did I know probably what a disadvantage I was really in or at. I just figured if they could do it, I could do it. And so I
Yeah.
always just kind of pursued things with that mentality.
Yeah, well, I had a similar experience in that started a company without the experience of going to business school. I remember I was at a conference and somebody, said, "Oh, where did you get your MBA?" And I'm like, "I never got an MBA." And it's an interesting comment of betting on yourself because I think it's sort of that personal drive and pursuit of a goal that for me was really what propelled me forward. It wasn't sort of listening to the naysayers, and plenty of people said to me, "What are you doing? You have 3 kids under the age of 5. Why are you
Wow.
starting a business? You're going to be working all the time and never see your kids." And that wasn't true. But can you talk a little bit more about that transition from Stanford researcher to entrepreneur and what those early days were like, both from a kind of, getting momentum with the business, but also just dealing with clients in the industry. I personally have found that being an innovator in this industry is challenging. It requires an enormous amount of resilience.
Mhm.
And I wonder if you could sort of characterize those early days for me.
Absolutely. When I was at Stanford, I was a faculty member, and prior to that, I was a resident. And I was doing research that I loved. It was in systemic sclerosis, and I was looking at differences between identical twins who had clear clinical differences and understanding were there genetic drivers, were there epigenetic drivers. So I was recruiting rare disease patients who were identical twins, which is the rarest of the rare. And I loved the research. I think that all along the way, since I was really young, like even maybe 18, I'd always been drawn to building a business as a way of taking value into a more scaled format, like into something where I think also you as an individual are a bigger driver of the outcome. And I mean by business, I mean something you start yourself. So, a business you make. And when I was at Stanford, I loved the people I worked with. I loved the problem. It really felt though that there was a lot of time and energy invested in areas that were less interesting to me. Just, the typical bureaucracy that comes with a big institution. Even the best institutions in the world, there's a lot of infrastructure and time you spend on just being a part of that institution. And it really appealed to me to start a business where I could focus a much greater percentage of my time solving this problem of how we could answer these research questions better and give these patients better healthcare. And I thought that the progress I wanted to personally make would be best achieved outside of the walls of Stanford.
Mm,
And it was really just a gut feeling. It had no level of certainty around it. It felt right to do something with a lot more kind of autonomy. And I began that journey by fundraising. I had a little bit of funding when I was working. And then it was really once I was able to get a bigger funding round that I decided, okay, I'm going to go at this full time. I'd already been employing people full time on engineering. In engineering, they were building my product, but I was still working as a physician and physician scientist. So once I secured enough funding to pay myself. And really, my student loans were my primary concern.
Yeah.
I needed, there are a couple $1,000 payments every month, something you don't have, you can't really just ignore those. And it enabled me when I was able to secure funding to, take that leap and to be able to make sure I could cover those commitments. And I would say it was just a gut feeling that
Yeah.
drove me to make that bet. Now, fast forward, once we had a product and it was clearly different than the way research was happening before. And it coincided with the development of Research Kit at Apple. So we were originally saying like mobile should be used for research in healthcare. And then Apple came out with Research Kit and it drove more awareness. And we had one of the first products where physicians could use our product without any technical skills and build an application for their patients to do research and connect with them on mobile. So a GI
Mm.
doc, a dermatologist, an oncologist has tools now to build their own solutions to care for patients and to really largely do research, connect with those research patients when the patients are out of the healthcare system, not in their offices. And, you know, that was at that point in time kind of where the technology in my vision was like, okay, wow, we checked that box. Doctors are using it.
Yeah.
Now we can do new research we weren't able to do before. And then I realized really to move the needle, we need to be able to facilitate new medicines development. And I didn't know how different that was than typical, investigator led research at medical research centers. And we began to explore how we could get pharmaceutical companies to use our technology. And to your point, that's a very different journey.
Yes.
And interestingly, there was a ton of interest because, as you know, clinical trials just aren't, they don't work in general. So, pharmaceutical companies, study teams, clinical operators are looking for new solutions. And at that point, they were very interested in solutions that could connect to patients using digital and mobile. But, again, this was very much more of an innovation effort, an edge case, not the main case.
Yeah.
And there was a lot of work we needed to do to make our infrastructure ready to do investigational trials, phase three, phase two, phase three trials.
Yeah. And well, I have a lot of questions from what you just said, but I want to kind of go back to the comment that clinical trials don't work. Is it from speed, from the fact that they are too complex? Is it the costs? Is it
Sure.
the efficiency? Like how how do you character? Can you say just a little bit more about that?
Sure. I think if we were to say as a category, can this be done differently and better? That would be yes. And that's what I mean by it doesn't work when you look at the way that we can scale other complex human processes.
Yes. Yeah. Okay.
And yeah, sorry, go ahead.
No, so that's interesting because I think from an innovator point of view, and you're no longer an outsider. You are like right at the heart now of clinical trials. But from in
Yeah.
the beginning, from the, like the outsider looking in, did you
Yeah.
sort of have this like, oh man, there is so much here that could be better, or there are so many issues that need to be addressed where the wheels were spinning about how to improve clinical trials kind
Yeah.
of as a whole?
Yeah. I mean, I think the original problem that clinical trials I felt faced was not any different than the clinical research I was doing at Stanford. It was really
Right.
about how do you get access to the patients who need access the most?
Yeah.
And I think, in my opinion, that's where, the legacy research infrastructure really breaks down. And I saw that with my own patients. I mean, we know 3% of patients participate. And then when you look at the, demographics of participation, it's nowhere near what it should be when you look at the prevalence across different populations in the real world or, in healthcare. And um, so to number one was really access, and that was the first problem I faced as a researcher myself. Now, once I got deeper into clinical development, I thought, wow, okay, there are many, many, many more challenges around this. And part of it relates to the complexity of the scientific question. and needing to address efficacy and safety, and understanding, deriving answers to those questions. And part of it relates to the fact that it's a global process. And a lot of academic medical research is not really often, sometimes it's global, but not always, but we know, phase two, phase three trials, these are global research efforts. They're global healthcare delivery efforts. And I think between poor patient access, currently the underutilization of technology, and frankly, because the best technology solutions in often cases just don't exist,
Yeah.
and the ability to retain patients and actually look at the data in a more meaningful time frame, those are all challenges that clinical trials face, and therefore our ability to develop new therapies and treat and cure diseases better and faster, those are the barriers.
Yeah, I agree. I just wonder, when you feel like you have a powerful solution to entrenched problems, but you're coming kind of bumping up against either reticence or resistance, or what I've experienced is sort of the comments of, this is such a great idea. Like with our innovation, I wish I would have thought of it myself, but we're not really ready. Our company
Mhm.
really isn't ready to, adopt new ways of working. Um, have you bumped up against that? And if so, how do you deal with that, both as a person, as a leader? Like um, yeah, well, yeah. How do you experience all of that? Because I'm just from a personal standpoint, I'm very curious because I've had to deal with that myself.
It is definitely a challenge, and I think, to be successful as a business owner, you do need adoption. So, to be successful in innovation as a researcher, say, I see this a lot at Stanford, it's like, we'll publish a paper to show this new technology has an
Yeah.
impact, and that, we can understand new things. But, I remember going to my board and being like, people are interested and customers really like it. But then it's like,
Yeah.
well, why aren't more people actually using it? Right. And it's a very fair question.
Yeah.
One of the ways that we addressed that one was, just finding companies who would start working with us and being able to demonstrate the value at a smaller scale. And I would say then the other part of our strategy was, as there was greater scale, largely because, in the pandemic, there weren't great alternatives to going for DCT or hybrid trials. It was one of
Right.
the only real viable options. We then put a significant amount of resources into researching the impact, not because we wanted to say, hey, we want to be able to convince the world to do this, but first and foremost, because we wanted to learn where the impact really was derived from. And Pam, and who you spoke with, she
Yes.
led those efforts. And then from that research, we were able to say, okay, this makes an impact. And then we were able to educate the industry around that impact. Now, I wouldn't say it radically accelerated adoption, but it was part of getting across like the valley of death that happens when you're in
Yes.
the hype cycle. And
Right.
you see these things with every technology. And
Yes.
in this industry where people are very much value data, they value an empirical perspective on, how things work, like the efficacy in this case of a technology. That type of evidence at scale across therapeutic areas, and across different types of clinical trials that we published with the Tufts Center for Drug Development, I think was really important. And we've continued to pursue those research efforts. First and foremost, so we know, hey, let's invest more resources here. This doesn't seem to be working. Let's, make sure that we understand why. And then also to, educate the industry about why new approaches and how new approaches do yield new value.
Yeah. I want to go back to something you said earlier about, you had an instinct, you were trusting your gut. You just knew essentially that this was sort of a path to follow. And when I first started my business, when I was on a run, and when I started that run, I had no idea that by the end of the run, I was going to have, sort of a vision for
Mhm.
a company, including like the colors of the logo. So, and it
Wow.
was just a feeling. It was an embodied experience, I would say.
Mhm.
And I wonder how much you are kind of leveraging instincts and your gut
Mhm.
now in terms of making decisions, pivoting when you have to pivot, knowing
Mhm.
when you have to sort of flex, even if
Mhm.
others are saying, no, Michelle, stay the course.
Yeah.
Is that part of the way you just operate?
Yeah, absolutely. The more in more years of experience I have or different challenges I face, I really have a deep appreciation for gut feeling. And, I think what's interesting, you had mentioned this on a run, this idea of flow state where you're
Mm,
able to access different parts of your brain and integrate information creatively is a really important state to be in when solving hard problems. And people,
yeah.
can access it through a number of different things. I also love to run. And so, oftentimes I've been in really challenging situations and I'll go for a run and suddenly start that run not thinking I have an option. And in that run, with categorical conviction that I got it, like I'm going to solve this problem. Um, but I do think one of my, a bit of advice for anyone in entrepreneurship who's maybe earlier in the journey is that the imposter syndrome is so real. And I think, because you've never done it before, or you're inevitably every day is like a new
Yeah.
day and new challenges,
Yes.
that you really should listen to that gut feeling and not discount it. And there was this recent debate on Twitter, and I think it came from Brian Chesky, who's the CEO of Airbnb. And he said there's a difference between a founder and a manager. And there's this founder mode. And I think it's true in a sense that, like, if you've been something since the beginning and it's kind of this, in a sense, it's a byproduct of you as a human, right? You've built this
Yes.
thing that you have a deep intuition and you can't discount that. And part of accessing that founder mode is that you can't let the imposter syndrome speak so loudly that you defer critical decisions to people that you actually, or I should say, you want to agree with the big decisions or you want to make them, but you have to feel good about them in your gut. And so, yeah, I think, listening to your gut is so important. And I wish I had done it more and more. And I continue to encourage myself to really do that.
Yeah, and I think once you have the benefit of some years under your belt and some experience where you've seen the positive outcomes of going with what your instincts are telling you,
Yeah.
that just compounds over
Yeah.
time. Um, I do want to talk a little bit about what you said about imposter syndrome, because, um, I do some from time to time mentoring of younger professionals, and it pops up, and it's usually not in the course of sort of a business situation where I'm talking to one of my employees, but it's usually when somebody's confiding in me that they either don't feel like they're getting traction in their career and they're not sure that they're cut out for this world or whatever. And I know even when I mentioned when I started my business, not having business experience, I certainly had it. And
Mhm.
so, for young professionals, maybe particularly women, what is your advice about just uh, sort of counteracting that? Um,
Mhm.
I call it head trash, like how do you
Mhm.
take out the trash when
Mhm.
you are sort of plagued by some of these insecurities?
Yeah, it takes awareness that that's where your mind is at. So, I think I'm kind of one of these people who's like, I'm going to figure it out. I can figure this out no matter what. But I would say where I experience imposter syndrome is where um, I will not. someone has a different opinion on a decision, and I will say, oh, they must be right, but not really listening to what I think is right. So it's more
Yeah.
in the micro, it's in the day to day. And I'd say that is my subconscious saying they're more qualified to make this decision because of their 30 years of experience, their XYZ. But at the end of the day, as the CEO and founder, I'm ultimately the most culpable for every decision.
Right.
So, and it's important to create an environment where you have collaborative decision making and you have a lot of, I'm going to say collaborative decision making, we have all ideas, but I've learned that you have to believe it's the right decision and always go with that decision. So, when I experience this of, oh, yeah, that doesn't feel right, but it sounds right, I now can identify that as imposter syndrome. And that's me saying, I'm not qualified to make this decision when I am. And I'm also ultimately the most responsible for the decision. So I think it first takes an awareness that this is
Yes.
something you have to understand, that mental voice is something that you can actually actively defeat once you identify it. And it takes great mentors, it takes self awareness. And over time, you're not necessarily quieting the voice, but you're better at making overriding it in a sense.
Yeah, I think it's really well said. I know, I mean, I call it a witnessing consciousness. And
Yeah.
part of the way I've sort of developed that is through meditation and mindfulness.
Yep.
Is that part of what you do, or is it more through sports? How do you develop that acute sense of self-awareness?
Yeah, I mean, I do think that, our subconscious or the unconscious mind is a reservoir of knowledge. And specifically, I think knowledge of the future and how things can, unfold. And so, the more that I appreciate that, like, okay, I thought this would happen and I can kind of actually can see around that corner.
Right.
I listen to that, but I do cultivate that through meditation, through running, even trying to think about it and also just being more aware of what that part of your brain is telling you. And
Yeah.
it's very unscientific in a sense, and I think it's dismissed in medicine and probably in some senses in business school. Um, but, I think there's a lot of interesting work on this, like Carl Jung and, the idea of the unconscious being a voice that harnesses a lot of knowledge. Freud was in a similar camp to a certain
Yeah.
degree. Um, and it's just like, gosh, the more you live life, you realize there's a lot there. So I think meditation and running and being aware that like you don't have to quantify every decision to know it's the right decision. And
Yeah.
for those like me, I was trained from the time I was young to be an objective thinker to a fault, frankly. I've had to learn how to value that gut feeling, and meditation and running and the awareness of its value, I think, is a really big part of cultivating a business sense. Not that different than a sense around patients and understanding who's sick and who's well. It's a
Yeah.
second sense to a
I
degree.
I agree with that. Yeah, in my 20s, I actually really became interested in Carl Jung and dreams and
Wow.
dream interpretation, and
Yeah.
was part of a dream group for 8 years. And
Oh my gosh, I love
so, yeah,
it.
and of course, it's not what I talk about in my and I studied molecular biology, and I have a
Right.
very analytical mind, and so for me, it was a new dimension to bring into my life many,
Mhm.
many years ago. And um, it has actually come into the forefront over the years of helping to drive decision making.
Yeah.
But it's not something that I would ever present to my board, or, oh,
Right.
I had a dream the other night, and
Oh,
that's
for sure. Right.
but there's so much. It's sort of a frontier. There's so much that we don't know or don't understand yet about
Oh my gosh,
human
it's so true.
consciousness, and it's a very exciting area, and it's what I love
Right.
about meditation too. It's just that it's a whole world, dreams are a
Yeah.
whole world. The um, kind of going inward
Mhm.
is it's a very rich landscape that
Yep.
can really inform your day to day. So we have that in common, Michelle.
I
But
love that.
um, so I want to ask you about like what has been the absolute biggest high at Medable, and what has been the lowest low like over the years?
I mean, the biggest high, there's, many. To me, it's always when you achieve something that, even sometimes the people on your team didn't think was achievable. Because the longer the journey goes, I just think one of the important things is setting your sights very high because you'll achieve things you never thought were possible.
Yeah.
And so, whether it was being a part of a clinical trial and then, we maybe took more time to set up the trial and then we get it live and fast forward a couple of years, there's a new drug approval in a new area that never had a treatment for disease before, right? It's like, wow, we were a big part of that. And then over time, we're able to show, we were able to enroll patients faster and patients were retained to, higher percentages. Like we were a part of the reason that that therapy is now available to more patients who are living with that condition. Like just that alone is just so amazing. And to
Yeah.
think we invented something and continue to invent something that improves that important human process um, is probably the most exciting thing. Um, but oh shoot, Patty, did I lose audio?
No, no, you're still
Okay.
good. Yeah.
Okay. And then for everyone to think, "Wow, we did that," when there are the moments where you're like, "We'll never be able to actually do this." And so then suddenly like, "No, we
Yes.
really can." Like, stay in the game, take it day by day or sometimes hour by hour, just work through this one problem, we'll get on to the next one, and then, again, it's just so important to know, like, there's a reason this is hard because what we're working on is very hard to do. But that's where the learning happens. That's where the innovation happens. That's ultimately also what shows you, hey, if we want to do this across, 50 or 100 more therapies, we need to think about it differently. And here are the things we learned that would help us take it to the next level. So those are the most fun things. I would say the hardest things are, with the downturn of the economy, and we were very reliant on outside funding because we were putting growth as the top priority over profitability. Back in 2022, when the economy started to suffer from inflation and there was a lot of economic uncertainty, and I had to reduce the size of the team. And, many of the people that we had hired and I had personally hired, I just think the world of them and would have loved to continue working together. But at the end of the day, my commitment is to the mission, and that is the most important, outcome we can achieve. So I had to make hard decisions to be able to ensure the future achievement of our mission. That was definitely the hardest thing to do, but it does make you
Mm,
stronger. It makes you realize that your teams, while smaller, in some cases perform better. And, you can do a lot in a resource constrained environment. And in some ways, resource constraints actually, I would say, really drive performance prioritization and importantly, innovation.
yeah. So interesting. Yeah. I mean, I think that sometimes boundaries are our friends at times in terms
Totally.
of making progress, which sometimes is counterintuitive. And, I think if, when my colleagues are listening to this, they're going to hear some things that you said that I often say within my company, because if what we were doing was easy, first of all, everybody would be doing it. And secondly, it would not have as big of an impact that it will have, So just by
Right.
definition, Medable is doing something, challenging, but with a noble purpose
Yeah.
and I heard it a few times during this conversation, um, creating opportunities and access for patients. Is that sort of the heart when you say the mission? Is that how you define, why you do what you're doing?
That is really the core driver, and I think that the benefit of that, if we can really do that well, is that we will be able to develop new therapies faster. So I'd say,
Yeah.
the number one driver and especially throughout my experiences as a physician and in training, is human suffering is so real. And when you are a person who is sick, it is the only thing largely you can think about and your life focuses on.
Yeah.
And it's amazing when people feel better that, they'll go outside and experience the same blue sky or the same rainbow or the same sense, but suddenly you actually experience those wonderful things because you have the brain space to live more. So really what inspires me is like, how can we make human suffering something that is not such a huge barrier and not something so prolific in the human experience? And I think that, really treating conditions and diseases well, and I've just seen it so many times with my patients and patients in general, I mean, is like it is liberating for life on a daily basis. Whether your life is longer or not, your days are just so much more vibrant if you are not completely consumed by the pain or the processes of a disease.
Yeah. And do you feel that, I mean, within your company, I'm sure you have operational people, you have technologists, you have computer scientists. Are they in their day to day, are they aware also of that North Star that you're following?
I think it's our biggest competitive differentiator is the individual team members' commitment to the mission. And again, we are in this incredible position now where we're working on some of the most innovative medicines in the world. And sometimes we just have to pinch ourselves that we get to be a part of
Yeah.
this. But also then if something's not working, like the stakes are high for humanity. So we all go all in to make sure that we can make, these processes as successful as we can from the lens of the technology and how it's supporting the science. But yeah, everyone at Medable, and we hear this a lot across the board. We're a decentralized company. We had to do
Hmm.
layoffs a couple of years ago. We have our own headwinds, but people are continue to come back to the mission and their colleagues. But the mission is what drives everyone, I think, on a daily basis, to give it everything they have. And I often say that like we got to leave it all on the field every day,
Yeah.
and you wake up and you do it again, and you do that, with a well of energy because of the mission itself.
Yeah. It's very inspiring. As an entrepreneur, do you feel, I mean, I know I kind of feel like I have to have one foot squarely in the present, one foot in the future,
Mhm.
because you have to be able to adapt and change. And I was wondering if you think of sort of your role in that way as well, of kind of needing to dive down into the details of the day to day,
Yeah.
but then also look at big picture. How do you navigate that?
Yeah, it's a really great question, and I like the way you framed it as like one foot in the present and one foot in the future. And then I would say yes, and that foot in the present is like super deep in the understanding. And I think that I truly believe that solving hard problems requires understanding the problem in three dimensions. And you know, I have found that if you don't really understand it, then you're in a suboptimal position on the solution 9 out of 10 times. So,
Yeah.
whether it is a contract or it is, a particular part of the product or it is your onboarding process for your, company, um, you need to know that either you or your team members are looking at the problem in three dimensions, and there is a very clear set of principles that guide what good looks like on the solution. And I
Mhm.
think then when you have that, you can scale it up and you don't have to be involved in everything.
Right.
But I would say in general, I've got a pretty deep understanding of the vast majority of facets of the company because like the success is in the details.
Yeah, it's really well said. Um, so you have uh, raised hundreds of millions of dollars in
Yeah.
funding. You have a now, I think it's a multi-billion-dollar valuation. Do you feel the pressure of that? Do you feel stress around the enormity of that?
I think the biggest pressure I feel, it's probably the pressure I've felt since I can remember, is just one of how do you harness the opportunity and like convert that potential energy into, kinetic energy, but really as defined by real value in the world. Like
Yeah.
potential, unrealized potential is unrealized progress. And so I don't really think about any one number in terms of valuation. I, of course, want to ensure everyone who bet on Medable that we under promise and over deliver. And I'm just going to ensure that happens because I'm very grateful for people who believe in our company. But to me, it's just like we have an opportunity to truly change the trajectory of how medicines are developed and how patients can access that science. And to me, it's just like the greatest pressure comes from like making sure that potential turns into progress.
Yeah. Well, I think it's the secret of your success, to be honest, that you are driven by wanting to make a difference and that you're not distracted, by the noise of, maybe, people who are maybe not completely on board or whatever it is. I think, it's very impressive. I guess my last question is just really around the future. Like, what are you thinking of in terms of how Medable fits into the way clinical trials are evolving? And what do the next 5 to 10 years sort of look like in your mind in terms of the future of clinical trials?
I think again, like coming back to what I said earlier, you've got to have a really big vision for where you want it to go because then someday you'll get pretty close or you'll get there and you're like, holy smokes, we did that. And like, it would be a shame to not
I
think
know.
so big that that wasn't the, greatest kind of horizon one could achieve. So
Yeah.
our,
I was gonna say
yeah,
we call them quantum leap goals,
yeah,
and they seem very like when we're putting them together, they seem so out of reach. But
right.
man, have we gotten close or made so much progress just by virtue of the fact that we set our sights very high. So
Yep.
yeah, I think it's a
Yeah,
great strategy.
exactly. And, our kind of quantum leap goal, to use your phrasing, is something we call the 1, 1, and 1. So right now we know, clinical development's 12 years on average. And we think, if you take the core parts of that and you really reduce them to far shorter goals and timelines. So, we're saying 1, 1, and 1 is 1 day study start. Can we have a technology infrastructure where you can understand exactly what needs to happen and lights on, start a clinical trial with that protocol on the same day? We have
Wow.
one that is called 1 day patient enrollment or patient access. So that would assume you have a network of people, participants, and that when that study is ready, you can actually enable that person with an opportunity to participate in clinical research versus the months and months and months it takes to find, participants and interested patients. And then the third one is 1 year study closeout, like 1 year study completion. And that means that we're able to generate all of the evidence to answer the critical questions within 1 year. And the assumptions there are that the endpoints are sensitive and specific. You need fewer patients, and the time to achieve those endpoints is much lower. So example is, in some of the early HIV trials, the clinical endpoint was actually survival or death. And then it was switched to viral load when we were using antiretrovirals. And
Right.
suddenly you could achieve a clinical endpoint in 6 months because viral load is a quantitative measure that you can trend over time very quickly. So, our 1, 1, and 1 is really our North Star. How do we close the timeline on study startup? How can we provide rapid access for the right participants and understanding, that network of people and the data that they generate to be matched for trials? And then the third of the 1 year study completion is how we think about, what are the endpoints of the future? How do you measure efficacy with new digital measures or new tools so it's more sensitive and more specific? So, in the future, we hope that we can actually demonstrate, and we will, are pushing hard to demonstrate that you could actually leverage the strategy to do a trial in a single year and generate high quality evidence that answers the core questions. And that process really looks very different than the clinical trials of today.
That's really inspiring. I love this conversation, Michelle. Thank you so much for spending so much time with me.
Thank you for having
I'm
me.
very excited about the work you're doing. And I feel like, what you're doing is a real catalyst for total transformation. So I'll be cheering you on from the sidelines. So
Thank
thanks
you.
again, Michelle. And I hope to see you
Likewise.
maybe at D-Farm or one of the
Yes,
conferences that we all go
absolutely.
to. Yes,
Yes.
I'll be there. So I'll find you.
Okay, I love that. And we'll have to toast to awesome entrepreneurs. And excited to hear more about your experiences. It sounds like they will resonate, and I'll probably learn some new things too.
Thank you.